Hello and welcome. I'm Deb Kupez. I'm a nurse practitioner that works with Birchwood Solutions. And today I want to welcome you to the Care for Nurses community. If you're not familiar with Care for Nurses, it is a community created to provide nurses with support, advice, and a safe place to talk about ongoing challenges with other nurses going through the same things as you are. Today, we have a special guest to talk about nursing from a larger perspective. The title is Nursing Broken? What You Can Do, Part 2. Our guest speaker is Eric Small, who has a master's and an MSN and an MBA, and he is a trauma outreach and injury prevention coordinator at WVU Medicine. He has a diverse background, having worked from housekeeping and aid to direct care nursing and nursing management. Our part 2 discussion, we're going to talk about how to prepare for participation in professional governance. We'll discuss where to get involved in the conversations, from internal shared governance committees to professional organizations, and even direct action and legislative advocacy. We'll also talk about the responsibility that comes with a professional governance perspective. Yeah, with that, I'm going to turn it over to you, Eric. Oh, we also have with us Mike Levinson, who is part of Birchwood Solutions. And our guest, it looks like you're a guest today, Amanda. Whenever, feel free to raise your hand or join the conversation at any time, okay? And Eric, I'll turn it over to you now.
Hey, thank you so much, Deb. I really appreciate that. So yeah, that was a really great kind of summary of some of what we talked about a couple of weeks ago now, and what we'll be getting into today. Unfortunately, I believe in clarity and correct communication. So I need to start off with just a quick correction from what I said last time. And that is, so last time I threw out a number when we were talking about sort of the volume of nurses in the state of West Virginia and sort of the impact that can have. And we'll touch on that again here later, but I said that there were 40,000 nurses in West Virginia. That's a little bit of an incorrect statement. There's 30,000 RNs, then about 5,000 LPNs, then several thousand more nurse practitioners. So in the ballpark, but I think it's important to have some clarity there for that number. We're talking about last week, we really got into sort of the differences between shared governance and professional governance. This idea that we are going to create our own table and invite others to come and participate with us as we sort of govern and engage with our own profession, and what are the things that we can do and tackle and who we can collaborate with. But we really have to be prepared for that. And that's one of the things that can be a challenge and can be an uncomfortable spot for a lot of nurses, especially early career nurses. And as I think I touched on last time, the early career nurse especially is one of the voices that's missing in a lot of the decision-making conversations that happens, especially if they're still direct care, like bedside care nurses. That's one of the voices that really gets left out. So in order to take on that challenge, in order to engage and participate in those circles, to be a part of those conversations, it's really important to have the right education. But I'm not just talking about formal education. And in fact, sometimes that formal education can pull us away from the bedside, and our perspective starts to shift a little bit. I'm guilty of that with my own change in perspective as I've advanced in my nursing career. I don't know what the experience of the direct care nurse is today. Even just 2 years away from my manager role has taken me away from that perspective to some extent. And so as much as I want and feel that I should, just as every nurse should be a part of that conversation, I want to make sure that those voices are being heard too. So while the formal education can give us that language that we need to engage in those conversations, I also think the informal, the collegial sort of education of, hey, this is the thing that I'm doing, come with me, bringing other folks sort of into those conversations, participating, hearing, learning through that experiential learning, whether that's on a unit-based committee or whether that's in one of these other circles or avenues that we'll talk about through today's session. That's where I think so much of that learning can take place, in addition to any of that sort of formal academic education that can come with that. And then the other thing is just knowing where to get involved. And that's really the next thing that I wanted to jump into. So we have to have the education, we have to have the knowledge to know where to go, as well as understanding the language and understanding the decisions that are being made and the perspectives being shared. So I always think it's really critical, and my advice to any, especially early career direct care nurse who wants to get started, is get started local. You do not need to. Your voice is welcome to be added to the bigger conversations, but I think starting at that sort of unit level is a critical way to start to understand what are some of the barriers that are faced when it comes to sort of taking ownership of our profession, taking ownership of our practice, of our profession, to see where we can go from there. And so that might be a unit-based safety committee, or it might be a falls committee, or it might be whatever that is in your institution, wherever that work is being done. Even if you're beginning as an observer, as you start to get comfortable and learn that language, you're going to be able to then speak up when you have that information, when you have that perspective that needs shared in that room. And that's the piece that I think is really, really critical. So starting local, I think is really, really important, starting at the unit level. The next place to really jump in, and this is a place that I've been kind of invigorated participating in some of these conversations, is with those professional associations. So it might be the Nurses Association. There's national and state levels of nurses associations, but those are amazing places to get involved, to be a part of some of that conversation around decision making. We just finished our legislative session here in West Virginia, and we had weekly conversations about, hey, what were the issues being legislated in the state of West Virginia that are affecting nursing? Who are the folks we can make calls to? Who are the people that we need to engage with to be a part of that conversation to do that? And there's all kinds of just education and collaboration opportunities that come with that as well. They've host seminars about how to understand, this element of the profession or that element of the profession, how to participate in one conversation or another. And so that's a really great place to be involved. Yes, Deb.
I just wanted to ask you, you've kind of stimulated my interest here on the legislative sessions you were talking about. Was that through a professional organization? Was it locally or?
So that was through our that was through our nurses organization or nurses association, West Virginia Nurses
West
Association.
Virginia Nurses. Okay, so that was a state committee that you're involved in.
Yeah, so that sorry, thank you for the clarity. That was with a state association, state level association. And again, just as I said, starting at the unit level, starting more local at maybe the state level too. I think certainly you can engage on the national conversation if you join the ANA, but at the WVNA, your voice really has the potential to be heard. And this is an organization for West Virginia nurses. That's who this podcast is meant for. That's who these conversations are meant to engage.
Okay. Well, I'm a member of WVNA, and I've participated in some of their things and get all the updates. Is it common? I'm a little bit of a newcomer to West Virginia. I don't know are there local chapters of WVNA that are available, or is it all pretty much at the state level?
As far as I know, it's all mostly taken place at the state level. Now there's different committees and things to get involved with. If you get on and join and just hop on to the first opportunity, you'll see. Trust me, they'll reel you in. They want that engagement, want that involvement, because again, the more voices that are added to the chorus, the louder the song is going to be heard. Yeah, the WVNA has been fantastic for my learning just about what some of the processes are for participating in these things, because they have these, they have seminars, they have webinars usually to sort of educate ourselves and to learn from others. They had one a couple of years ago that was really fascinating. That was all about the 4 nurses who were running, some to be some to stay in office and 2 others who are running for office in the state of West Virginia, and to get to have that conversation with them and hear from them about the challenges and what that meant. And for the 2 nurses who were in the state House of Representatives, that's been a really House of Delegates, excuse me. It was really eye-opening to sort of hear their experiences and how they've had to sort of gain some footholds in their own parties, in their own groups, in order just to even have some of a voice. And for the last couple of years, it's been 2 nurses co-chairing the House Health Committee for the state legislature, and that's been huge in order to do that. And this is where you can learn and have those conversations, is through something like WVNA. I can't recommend participation there enough. But that might not be right for every nurse. So there's other professional organizations too. It might be a specialty organization. You know, I was orthopedic certified once upon a time. It might be that organization, NAON. It might be any other number of places that you can go, and all of them have some component of, hey, here's where we make decisions about or learn about what is the best practice for our specialty, our group, our profession, and how do we then advocate for that in those decision-making circles. And so those are really great places to start. The Nurses Association amplify nurses' voices, regardless of which one you're in. I can speak mostly for WVNA, but they collaborate with advanced practice nurses in the state, the School Nursing Association, the Hospitals Association, other legislative allies that they've gotten to know over the years. These are the delegates who listen to us when we bring an issue of concern. You know, they really hear us. Now they still have to, you know, do the things that they need to do in their individual districts. But at least when you get that ear, you have that voice, you're helping them to make an informed decision, right? And so that's one of the powers, I think, that a nurses association can have. And they do some formal lobbying too. And I'll talk a little bit about sort of what it takes to be heard. And unfortunately, that is a component in a lot of cases. You can work for a campaign. That's another place to kind of get involved. Again, thinking nationally, thinking on at the state level on a larger scale. Here are the ways that you can kind of get involved. And then there's also direct action. And so that might be running yourself. That might be organizing a march or a rally or a protest or whatever term you want to apply to it, something to have a group of voices heard. I spoke to a nurse just a couple of years ago who was really passionate about a topic that was important to her, that was important because of her experience in the ED. And she organized a march here in downtown Morgantown. And you know, what was the impact that it had? It's hard to say, but it was really powerful to see her using her voice in that way, and to see her sort of take that on.
That's impressive, yeah.
Yeah. And so there's all kinds of different ways to get involved. That's a few, and those are the places that any nurse who's saying, I have these concerns, I have these opinions, I have these experiences in nursing that I think need to inform decision-making at whatever level that's happening. I think those are some of the best places to get started. It's your state level nurses association. It's always good to join the national level too, to see kind of what's going on and who's advocating for what, and then, you know, where can you engage at the unit level? Where can you engage within your department, within your organization, to hopefully, you know, improve patient care, improve the nursing experience as a part of that as well.
I have a question for you. You mentioned campaigning for political candidates too as one of the ways to get involved. Have you found in your experience here that there's any resistance from your hospital management when you get involved in a political campaign? You know, sort of should nurses be neutral, or is it okay to like?
Yeah, there are going to be times when nurses are going to be at odds with their organization, or a nurse might be at odds with their organization in terms of what they would advocate or legislate for, or maybe just philosophically opposed, just in terms of, you know, something that's regulating and things like that. I think it's really critical that nurses, when they're in those settings, when they're acting in that way, they say, I'm acting as a private individual. You know, I am not a representative of my organization. Does that mean that you won't get blowback? I don't know. That depends on the culture of individual organizations. I've heard stories of nurses who've had both experiences. Some who are said, hey, good on you for participating. I disagree, and the organization is going to say this, but, you know, hey, you know, you're welcome to be a part of that as well. But I've also heard folks who did receive some blowback. One specific piece of legislation that was being chased this year again, and I don't remember the final outcome, or I'd share that, was surgical smoke in the operating rooms. That's known to be a carcinogen. That's been discovered over the last however many years. And so there was a push to create legislation that would help create some workforce protections for folks who are in ORs. And there were times where I heard about an organization where a number of nurses who worked in their OR went down and advocated for this legislation, advocated for these regulations, and their organization was upset about it. And they did get some blowback. Now, did any of them receive significant penalty? Not that I heard from the few folks I talked to, but they did get some critique from that. You know, I think it's important for nurses to be willing and able to sort of stand up and say, no, this is the right move. This is the right thing for us. This is important for us. And, you know, but when you take that on, you can receive blowback, you can receive criticism, you can receive those things. Even just sharing ways, as we are today, to get involved, the potential is there that somebody hears something and takes it a certain way, and you get that sort of feedback. It is real, or it can be a risk. I'm not concerned in this conversation for myself, but it can be. And that kind of actually leads in, and now that we've kind of touched on that, I think that's a great way to talk about it, is recognizing the responsibility that comes with being a part of these conversations. There is professional governance, as I talked about last time, is about owning your profession, having that table, inviting others to collaborate, and sort of having some control, some autonomy as a profession for yourself. But that comes with a lot of accountability and responsibility. So those things that you advocate for, those things that you change, those decisions that you make, you then have to own. You're not just one voice maybe being a part of that. Once you take some of that power, you then have to take that accountability that comes with that too. And that is an instance of that. If I go and I say, hey, I want X, Y, and Z in the legislature, and I speak before, I've spoken before the Senate Health Committee a few years ago on a topic that was not a popular topic with some of our nurse administrators, but we had a conversation about that, about where I was coming from and understanding their perspective, and I think came to a good understanding, and there was no lost respect between us, although we still might not agree. So yeah, I have to take ownership for that. I have to be able to speak that language and understand that something I'm going to be held accountable for those actions I take too. I think that is an important perspective. If nursing takes on a true professional governance perspective, we have to be knowledgeable, we have to be educated, we have to know what we're getting ourselves into if we do that, and we have to be able to accommodate the blowback. We have to be able to fix the things that we break when we make a decision that doesn't work out. And so that's one of the challenges that comes with those things also.
Okay. So
go ahead.
Go ahead. No, go ahead. No, go ahead.
I just wanted to talk a little bit about you know, where we see some of the barriers. And I've touched on a lot of these as we've gone along in both the previous discussion and so far just today. The biggest barriers for how to engage. Or ways to engage, ways to have nursing voices heard. And the first one is what I'm hoping to address, and what we're all hoping to address with some of these conversations, is knowledge. Knowing where to start, where to go, where to participate in order to hopefully start to make an impact or be a part of that conversation. But you also have to understand the language that's being spoken. The reason that I got my MBA was so that I could speak the language of the business folks who make a lot of the decisions in healthcare. It's the reality of what that is. I have no desire to be a business owner, manager, whatever, but I want to be able to speak their language, because that's where so many decisions are currently happening. So I need to be able to understand where their concerns are coming from and be able to advocate for myself. I have to understand that. That does not need to be a formal education for everyone. I'm not advocating that everybody has that MBA, but have that mentor, have that person that you can go to say, hey, they talked about this and this. I don't know what those terms mean. Can you help me with that? That was something that several of my colleagues did when I was a nurse manager, to be able to bounce ideas off of each other. Hey, they were talking about this and this. I've never heard that term before. Can we go through that? Do you know what that means? That's one way to sort of overcome that barrier. And I think it's important to establish sort of some mentorship relationships in order to hopefully grow and learn, whether that's you as a mentor to others or finding somebody who does speak that language in order to participate in those avenues. And then just knowing where to start. And again, that's what a lot of this is about, is sort of knowing, hey, this is a place you can go to start to be a part of this conversation, to jump in and participate a little bit. The next barrier that I see is one that is harder to categorize, but really, really real in the experience of most of our nurses, and that's our capacity. That direct care nurse is worn out after the end of their shift, and often for a day or two beyond.
Right.
It's an emotionally and physically draining experience sometimes to be a nurse. Not always. It's also very, rewarding. I don't mean to scare anybody away from it, but those impacts are real. And so how do you build that latent capacity? How do you create that within yourself, have the resilience to then push through and also do this other group, this other participation, this other committee? It's a lot to ask. But from my perspective, one of the reasons that we don't have that latent capacity is because we're not in these conversations. Right? We're not able to take that ownership and say, hey, we have to draw the line here because we don't have any more to give, and say that. So I think that's one of the key barriers as well to that.
So I have another question for you.
Yeah,
So I mean,
please.
I was, while you were talking, I was going to say not so much capacity, but time. Where do you find the time? Which is
Yeah.
just another element of the same thing.
Yeah.
But so how do you find the people that are passionate about the same thing you are? I think the thing that helps is if you really have a passion about something that you want done, that even if you don't have much time or capacity, somehow you can squeeze it out of yourself. But how do you get all those like-minded individuals that want to be passionate with you?
Yeah. That's a really challenging problem too.
Yeah.
I think the first way is, and this sometimes is putting yourself out on a limb, but is to broadcast those things you're passionate about. You'll find your allies, you'll find the folks who that resonates with if you're open about it. And that's speaks a little bit to that concern for low back, or that concern for the accountability that comes with stating those things openly and honestly as well, is that, hey, yes, there might be blowback, but I also may find allies. I also may find that it might not even be another nurse who that resonates with. It might be somebody in another health allied profession, right? It might be the respiratory therapist who's been working with the patient for hours on end and is seeing the same barrier that I'm experiencing. And that's the thing that is difficult for me. And so now we have an ally. Now we have the opportunity to collaborate with those other professions as well, as we find those things.
Okay.
And it's through different platforms. It's being open, whether that's online, social media. I know those are not always the healthiest environments, in fact often are not, but be able to speak out and share the work that you're doing, I think is critical, because that's how you find those allies. That's how you get to participate in those conversations as well. That's one of the things is the sort of the last barrier, the last thing that I like to touch on is just how are we heard? How can we be heard? Through those avenues, I think we address a little bit of it, but the fact is, especially in sort of legislative spaces and governmental spaces, money is the thing that speaks the loudest, right? I hate that about our system, but it is the system we work within. And so through some of the organizations that you can join, again, WVNA, ANA, those have some lobbying attachments. Some of those dues may go to this, that, or the other fund, and so you pool resources that way to speak together. but it's also important to acknowledge the numbers. And that's part of the reason I wanted to make that clarification sort of up front is, yeah, money speaks pretty loudly, but numbers can too. And while nursing, again, is not a monolith, we talked about that last time, every nurse may have a different perspective, but on those spaces where we align, where we do have that common interest, now those numbers can speak volume. I'm going to throw these out a little bit for you. So 30,000 RNs, correcting that number, 30,000 RNs in the state of West Virginia. That's almost 4% of West Virginia's workforce. That's huge for a single profession to have that kind of capacity. I like to highlight for folks, for anybody who doesn't know, a number of years, and it's a political talking point, I understand, but a number of years, coal miners get kind of talked about in West Virginia in our history. That's such an important part of our history. But there's only about 11,000 coal miners left in the state of West Virginia.
Wow.
We have 3 times their number, but we don't get talked about like that, right?
Right.
So are we engaging in utilizing some of the power of numbers correctly? And that's, again, where do you find that? Where do you get involved? That's where you find those numbers and start to kind of see, hey, here are the opportunities. Here are the places we can do that.
Yeah.
So those are some of what I wanted to share, and I'm so grateful for the ability to come in and start to talk about these things with other nurses who have had concerns, who have had frustrations, who've had anxieties about their profession or about their work. And I'm so grateful for the work that Care for Nurses is working to do in these spaces, as well as so many other folks who are trying to build resiliency. I want to see nursing build sustainability more than resiliency, because in order to be resiliency is great when you're facing adversity. How can we build spaces that don't face as much adversity? And so resiliency becomes less necessary. And I think it's through some of these avenues. I think that's how we do that. We get involved, we have our voices be heard. And I think that's so key to sustaining nursing, especially direct care nursing.
Well,
sorry,
thank
Deb, go
you.
ahead.
No, I was to say thank you for those kind words for Care for Nurses. Amanda, I know you're new to our conversation. Is there anything you would like to add, or are you just here to listen today?
No, I'm just here to listen to Eric. I've been a frontline staff leader as well. I work within our quality department. Eric and I actually work for WB Medicine, so I'm happy to support Eric. We have shared some of these topics of interest together. So keeping staff members and frontline staff involved is something that we always struggle with, and giving them the opportunity to speak out and really bring to the table and speak up. I think healthcare has changed over the years tremendously from whenever I first started as a nurse, but teaching, the proper avenues to really get staff's voices and our nurses heard is something that I'm passionate about. So glad to be here.
Thank you, Amanda. Amanda, just so you know, we do have the Care for Nurses community includes, we'll have a podcast again in 2 weeks. Is that right, Mike? I don't have the date.
Yeah, every 2 weeks.
Yeah, so look for that again. We do have a lot of blogs up on the website, carefornurses.com. That we have video conference on Monday and Thursday nights. You can check on the website for the times for that. Those are designed to be support groups of any small groups of nurses that want to dial in. They're led by myself or Eric. So we're looking at any ways we could reach out to West Virginia nurses and try to get them more engaged and try to get them to do what you and Eric are doing. So thank you for coming today. So
thank you for having me.
Yeah, and Elizabeth, I'm not sure if you want to add anything today or just listening.
I actually do have a question.
Okay.
Please.
So I'm not a nurse, but I'm thinking, like, for the people that are interested in doing something, but they don't have the time, they're exhausted, maybe they're not ready to lead the charge. What is the minimum thing that the typical person could do? Like, is there something, a baby step that everyone could do?
Yeah.
Is there a mailing list they can get on? Is there an email they could send to their representative? You know what I mean? What's a 10-minute thing we can get people to do?
I think and I, I'm not a formal representative of the organization, so it's hard for me to speak too strongly or to speak out of turn for them. But I think the first thing you can do is join your nurses association at the state level, or if there's a more local chapter there. I think is the most important and critical thing you can do. Through that, you get access to some of those decision-making spaces, to some of those conversations within that organization that then hopefully amplifies those voices out. But even if you're not able to do that, you get the calls to action. We got a call to action this morning about a bill in the legislature that we're hoping the governor is going to veto. And that's about childhood vaccines. And I know that's a controversial topic for some, so I don't mean to say one way or the other, but as nurses, from a public health perspective, there's a call to action to sort of say, hey, we don't think this is right for the children of West Virginia and for the public health of West Virginia. And so just getting yourself on a list like that, they'll share some language, they'll give you some emails or some phone numbers to call, and then you can make those calls, and at least you're adding that voice, your voice to that. It's a small pool of people who really engage in that right now. And so again, that's some of what this is about, is to try and find those folks who are willing to say, hey, do this. And if you do that, share that with your colleagues. That's something I've been doing as we've gotten call to actions. I've just shared it with the folks here in my office, 7 or 8 of us, but that's, 5 or 6 more voices, going to that, who may not have joined, and I hope they do, but may not have joined, sort of sharing that information, sharing those opportunities to speak out.
Okay. Great tips, Eric. Thank you very much. And good questions, Mike. So
Yeah.
I think go ahead.
Oh, sorry to step on you, Deb. I just wanted to make sure, for anyone, we were talking about continuing this conversation specifically about this topic on our Care for Nurses platform. So if anyone listening to this wants to just, like I said, continue the conversation and maybe talk about having a small group with Eric to talk about this, just post something in the discussion on our platform, and we'll coordinate something.
We can arrange that.
Yeah.
Okay.
Yeah. I hope to be able to help share some spaces for folks to talk about ways to engage in the barriers that they face, because that's going to help inform all of us how we overcome those things. And so look for more information on that. Let us know if you're interested, and absolutely reach out.
All right. Well, unfortunately, once again, we've gone a few minutes over, but we had a full discussion, so this was great. Thanks, Eric, again, and thanks, Mike, for all the coordination. Amanda, it's good to meet you. And our next call will be, I just looked it up here, April 3rd at, I want to say at Eastern time, right? At noon, at 11:45. So April 3rd at 11:45, we'll have another conversation, and we'll keep going from there. So, okay. All right.
Sounds great.
Thanks, everyone.
Thank you all.
Thanks, guys.